Yeah, so what we've done is we've taken these really great services that were typically only for really large employers or large entities and bundled them together into one membership.
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm your host, Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management for Professionals.
I've been looking forward to our conversation with Heidi Rasmussen, the co-founder of freshbenies. I just love that name. Welcome, Heidi. I understand you're a graduate of UT Dallas School of Management.
Comments. Yes, I did. A few years ago, I think before there were comments, but you know.
Well, guess what? We have 28,000 plus students now.
That's crazy. And the campus is so beautiful.
It is.
So much different. It's exciting.
Yeah. So many people have fallen in love and really helped promote what we have here.
Yep.
The School of Management here, it's the largest of all the schools at UT Dallas. And it has a nice footprint. I'm so glad we're here talking about healthcare and the business of healthcare. The footprint here goes from undergraduate to graduate to executive education. But I'd really like to learn more about freshbenies. As the name implies, it's a fresh approach to benefits.
That's right.
And you founded this 7 years ago?
We did. My husband is ex-Canadian, and he skipped the border. He had a health administration degree over in Canada, came across in the 90s, and then got into the health insurance side. I was born and raised at JCPenney, so I literally worked my way through, started at 15, worked my way through high school and college, and this college, and then eventually got into the management program and was in the Seattle area most of my career, but got moved here in 2000 to work at the corporate office. So most of my background is marketing, brand management, very consumer-oriented, customer service, things like that. And then he had this background in healthcare, and as the ACA was what some people call the Affordable Care Act, some people call it Obamacare, it was starting to come into the into our lives, and it was about to be signed. And he started seeing some really cool benefits that were out there that he knew. What he saw in Canada could potentially be happening here, where out-of-pocket costs would start skyrocketing, things like that. So he saw that trend, and he was just like, boy, people are going to really need some help as that comes into play, and out-of-pocket costs are going to increase and even more. And it was at that point where I said, well, do you believe the numbers? Do you believe that's really what's going to happen? And he's like, yeah. And I said, do you believe in the services? Do you think people are really going to use them and that they're really helpful? And he's like, absolutely. And I said, well, why don't you start a company? Just do it. I mean, he was working in the health insurance side of the industry. And I was like, why don't you do it? And he's like, no, that was Friday. On Friday, he was like, no. And on Monday, he was like, I'm totally doing it. So...
Well, I can see where your marketing background and your enthusiasm for getting the word out kind of fits in. So I looked at your website, and you're helping both employers and individuals control their health. And you have a little rhyme going here: the healthcare dime, time, and peace of mind.
That's right.
If that's not a jingle that resonates well with people,
it does.
But if you guys are working to control out-of-pocket costs, save unnecessary claims for the employees, whether they have a medical plan or not, and you're doing this nationwide, wow, it almost sounds too good to be true. Tell me more about actually what type of services that you offer.
Yeah, so what we've done is we've taken these really great services that were typically only for really large employers or large entities and bundled them together into one membership. So within that membership, an employee or a member has the ability to call a doctor 24/7 and get a prescription written over the phone. So we use a service called telehealth for that. And it's anything from sniffles to I've got a rash to pink eye, all those things that, your kid comes in at usually 5 o'clock on a Friday, kids get sick. That's what everybody tells me. I don't have kids, but I hear it a lot. And so that's somebody that you can call and actually get a prescription written, sent to your local pharmacy for just those basic kind of urgent care center type things. So not replacing your family doctor, general practitioner, but that's what that does. And then we also have the ability to email specialists 24/7. So things like I smash my toe, what do I do? Or things you don't necessarily would go into an urgent care center for, but it's really kind of digging at you, or you're really not sure how you might not. I got to tell you, as I age, more and more things come up that I use this service for. So things that you're just like, gosh, that's really nagging at me and I want to figure that out. But anywhere from an oncologist, like I need a second opinion, or I need somebody to tell me, is this really a good diagnosis, all the way down to a fitness trainer or a dietitian who can help you get your diet in order. So that's the second service. The third service is what we call advocacy, or a navigator, to help you navigate the system. I mean, obviously, it's a complicated system. It's very complex. So if you ever need pricing on something, like let's say I need a colonoscopy or I need an MRI, I can go to one place and pay $5,000, but right across the street it might be $500. And I don't know that as a typical American, nor do I necessarily have time to do all the research and everything. So we end up just kind of paying for things that aren't necessary. So our health pros help with that. They'll help negotiate and review medical bills, because as you guys have probably know, medical bills are wrong much of the time. So they'll look at those and then they'll actually negotiate. So it's kind of a agnostic, independent person to help you as the person who's paying out of pocket, and help you kind of navigate through that and be on your side. And then we have these savings networks. So prescriptions, diabetic supplies, vision needs, dental, you name it. There's 9 different services. So we bundle all that together, and it's about $12 per family per month, 12 or under, depending on the size of the group and things like that.
Very interesting. So if I work for a large employer and I have healthcare benefits, and I might have an employee assistance program, I might have certain things that they do for me, would I still be wanting to use your service? Does your service extend beyond what I would get through my benefits where I work?
Absolutely. It really depends. I mean, a lot of the carriers today, or health insurance companies, are bundling in a telehealth service, or they might bundle in advocacy. With the telehealth service, what we found, and this is our differentiator, is when telehealth is delivered through like your normal health plan, most people don't even know it's available. Most of the time there's a pretty decent copay, like maybe $45 or $50 copay. And people are reticent to try something new if they're thinking, gosh, I'm going to pay the $45 or $50, and then is it really going to work for me? Am I going to get that prescription that I think I really need? But if it's no cost, and there's no cost to use any of our services. So all of that, whether you're calling a doctor, emailing a specialist, using a health kind of navigator, a health pro, there's no cost for any of that. So we get really amazing utilization. So typically with a health plan, you might see 2% utilization, meaning in a group of 100 employees, they'll see 2 uses in a year, an entire year, and we are 71% utilization. So a lot of employers say, gosh, I like the idea of telehealth, but I really want people to use it, because when they use the services, we're saving them $462 per use of our services. So it really helps the employer on the bottom line claims costs and their bottom line, but it also helps the employee, for their out-of-pocket costs. So yes, there's certain things that you might also see in your plan or in your benefits package, but what we're doing is bundling it all together, making it really simple for the member to use, and educating members and educating people on how to use these services so that they get it and they really are high utilizers.
I think that's the magic word, education.
Yeah.
That's got to be the driving force to make any of these programs successful.
It's true.
Most people do not understand what to do until something happens.
Exactly.
For example, do you know if you had an emergency, where would you go? Would you go to the hospital nearby? Would you go to one of these ER clinics? Would you call your family physician? Mm-hmm. What is your strategy? What is your plan? So educating people about the programs that are there, getting them comfortable with it, that's got to be a huge, huge assignment.
It really is. And you're right that people, they don't really necessarily care until it's time to care. And when there is an emergency, we educate people ahead of time. Call your advocate or call your health pro and ask, where should I be going? If there's an emergency, where should I go? Like if I go to one of those places that says urgent care center on it, but it's really an ER after hours and you're paying ER prices, that's going to really hurt your budget. So really getting educated on those things. And so the great thing, and I think where we excel, is we always meant to get members to use the services. And so we're constantly educating. And, it's funny, you look at like the PNC side of insurance, and they've got the Gecko for Geico, and they've got Flo, the progressive lady, and like they're very consumer oriented. Then you get to the healthcare side, and it's very sterile and always blue. I don't know what the reason is for blue, but always a blue color, and just very sterile and not consumer friendly and not engaging to a consumer. And so that's what we did, and we took a lot of kind of flack for that in the beginning because people are like, well, this is healthcare. You have to be more serious. But people just want to be engaged and they want things to be simple. And so we try to make this as simple as possible, from the experience to understanding what they do to how to use it. And that's really the trick and the key. You're right.
Well, I would think that the return on investment, if you can show somebody in a very compelling way that you're going to save them money. You mentioned earlier that transparency of pricing. Mm-hmm. It's not transparent. It's a shame that you have 19% of the GDP veiled in secrecy in terms of pricing. And when you see some of these bills that come in, I was talking to a person the other day, and they said they had a back problem. It was an elderly person. One of the graduates of our class, her mother was in, said, I went to one of these clinics, and my bill was $16,000. Yeah. And so I called up my insurance company, and they said, don't worry about it. We'll send you an adjustment. And it came down to $1,200. Mm-hmm. And then they called back the next day and said there's no charge.
Oh my goodness!
Now, is that not distressing? Okay.
Totally.
So with your program, can you show people that if you sign up for this program, $12 a month, that $144 that you're going to spend, that you will save that much?
Oh, sure. I mean, even if you only used the telehealth service one time, most people pay $150 out of pocket to go to an urgent care center. So if you used it one time in an entire year, you just paid back the entire. But there's up to 16 services in one membership. So There's no way. You can put in your prescription into our app or into our portal, and it'll tell you where you need to go in your little local area. Literally, you can be standing in one pharmacy, and one of our employees just told us this. I was standing there, I looked at it, and they told me, well, first of all, her prescription fell off the formulary. After 3 months, they said, okay, it's no longer going to be on the formulary. She's like, great. So it went from $0 to $235 when she walked in to pick up her prescription. She's like, oh my gosh, what am I going to do now? So she gives the card to the pharmacist. The pharmacist says, okay, yeah, I can take this much off with your Fresh Bennies membership. And then she's like, let me look. So she looks in. It was a larger pharmacy chain that she was standing in. And she looks, and in the app, it said if you go right across the street to more of a mom and pop, it literally was, I think, $15. So she saved that much just by being a smarter consumer with her health care. Furthermore, she then called the advocacy service and said, what is the deal with this prescription? And they said, actually, I did a little research. It was the 30-day that dropped off the formulary. The 90-day is still on the formulary. So if you just order 90 days, it's totally covered. But she never would have known any of that if she wasn't kind of being prompted to be a better consumer.
Yes, that navigation service is pretty powerful.
Totally.
Kind of when you go down the Colorado River through the Grand Canyon, the most important person in the raft isn't you or your husband, it's the guide.
It is the guide.
It's the guide who's been down the path before and has basically knows the route, knows the ways to go.
I like that healthcare in that analogy is the Grand Canyon. That's pretty much how it feels now.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
So how do you go to market? Tell me about the business of going to market. Is your sweet spot with any size employer, larger, smaller individuals? Where's your sweet spot for this?
Yeah, it's a great question. And there's so many different great fits for us in the market. So we typically are in the 100 to 3,000 employee range for employers, but we go all the way down to 5, and we have tons of groups with 5 employees. Love them, love all of them. Typically over 3,000, they're kind of doing their own thing and pulling together the benefits in a different way or however they want to do it. So that's great. 95% of our business is employer paid. So it's not a voluntary option. It's not like, hey, do you guys want this? It's much more, we're doing this because we're seeing the out-of-pocket costs are going up. They don't want bad PR in the enrollment meetings. They really just want to be able to say, gosh, we have to take your out-of-pocket costs up, or your max is up, or we have to do something to the formulary, whatever it is. But we're going to add no-cost doctor visits over the phone, no-cost email visits with specialists, a health pro to help you navigate through what's about to happen with your new health plan, and all that. And our advocates or our health pros are educated on what the plans are. So they actually know when the employee calls in what plan they're on, and they know what the plan entails. So there's a lot less work there for the employee too, or the member.
Okay. Do you use any broker communities to help?
Absolutely. So we typically sell directly through brokers, and those brokers then present Fresh Bennies as part of a strategic benefits program. So it's part of the program. And sometimes our really great brokers that sell like over and over and over, they are looking at the health plan and saying, gosh, how can I find whatever the amount is that Fresh Bennies cost for them, if it's 12 or under, how can I find that $12 somewhere in the health plan? Do I take the deductible up a tiny bit? How do I tweak the health plan to find $12 so I can totally fund Fresh Bennies and there's no increase to the employer in general? So that's how most of them do it, but it truly just rounds out all those things that fall through the cracks in a health plan is kind of where Fresh Bennies comes in to help out. So it really helps.
So is Fresh Bennies a nationwide offering?
Yep, absolutely.
So you started locally.
Started locally, and because of Reid's, my husband, because of his background in the insurance industry, he's speaks a lot on the Canadian healthcare system and things like that. So, and he was speaking all throughout the United States, and our product is available all throughout the United States. So a lot in Texas, yes, but every state at this point, except for, I think, Hawaii. And we're totally working on that because we need a visit. No.
That's quite a reach. With our programs here at UTD for healthcare, for the executive education, we're fairly regional in Texas, but we actually have people flying in from Hawaii and Seattle and LA to attend our classes. So it's one of those things where when the good word gets out, right, people will find out about it. And if there's value there, they're going to buy into it right away.
Very true.
So there's a lot of disruption in the forecast for healthcare. You look at a company like CVS and Aetna, and they're trying to manage chronic care at the pharmacy window today.
Right.
You see a lot of other, Berkshire Hathaway and others combining their resources together to try to take care of their employees differently.
Yeah.
Do you have a play where you could take this solution that you've organized and really built up and repurpose that into some of these disruptive environments? Can you go big with this, even bigger than what you are now?
Yeah, I mean, we think that it can be as big as anything. I mean, it's definitely, when I look at any product, you kind of go, who is this good for? I've never worked with any product that I could look at it and say, this is needed by every American. I mean, these services, every American needs these kind of services. One of the things we just started talking about is unbenefited employees. I mean, this is a tight job market. And how do we just recently were talking to a large restaurant chain, and they're like, we've got these great employees that will never be benefits eligible. They work 30 hours a week, whatever. They have the keys to the store. We love them. They've been with us 2, 5, 10 years, but we don't do benefits for that type of employee. So what else is there? And what can you do for $12 or under a month that gives them that much value? You can give them half a dental plan, and that's not really that helpful because we have 2 sets of teeth on top and bottom. But if you think about these things, a lot of employers say, I can't even buy lunch for my employees for this amount a month. And it's definitely services that they need, especially if they're not benefits eligible or have benefits. And we're also seeing MEC plans. There's a lot more of those popping up because it meets the requirements for the ACA. It gives something to those employees that maybe the employer can't totally afford the full benefits package. But then putting this alongside a MEC is really, really helpful for that. Or captives are great also because every dollar they save goes straight to the bottom line for the captive. So there's a lot of different places where we're able to say, gosh, this fits here, this fits there. Associations,
yes,
just some really good fits.
So the competitive landscape, are others out there similar to what you're doing, or are you fairly unique here in this market?
Yes, and we hate that. No, I'm kidding. We are fairly unique. I'll say the biggest differentiator for us is that utilization and that engagement of the member and really helping them understand what the services are and how to use them. And that, 71% utilization is just... it's huge, and really getting people, getting them to activate quickly and getting them to use the services and making things so simple for them that they don't really have to think about it. Just go in there and let us lead you through the process so that we're ready when you're ready kind of thing.
So we're going to have some future podcasts that will address some of the concerns or ideas or philosophies behind Medicare for All. So we'll leave that for a future discussion, but would your solutions and offerings work today with people that are on Medicare?
Absolutely, yeah. And a lot of times when we're on Medicare, it's hard to find providers because they're not either accepting Medicare or whatever. So you've got that health pro that can help walk you through it. So they know the Medicare system, they know how Medicare works. And so you've got a health pro that can say, okay, here's some great options. Not only are they taking Medicare, but they're also high quality, and we have great ratings on them, things like that. So they're not just looking at price or availability, they're looking at quality too. So, and I think personally, I just said as I age, I have more and more questions for our doctors at Doctors Online that I can email them. So absolutely. And the telehealth, just things pop up, and it's great to be able to have that option. No matter who your local providers are, you've always got somebody that you can talk to on the phone. And then obviously, prescriptions, there's a lot more with our Medicare friends, and some people don't have full prescription coverage. So we've got our RX savings, and then we have medical device savings, and we have lab test savings. So there's a lot of other things that could be very helpful for them.
So you're going to take advantage of these advanced technologies as they come forward?
Absolutely. We're always looking for, first of all, new services. So like we're just now starting to hear about, our Gen Y friends that need to pay back, what a coincidence, school loans, right? And so employers are looking for, how can I help my Gen Y or my millennial employees with student loans? We want to keep them, we love them, and we want to give them extra benefits. So we're like, well, how could we roll that in? What about genetic testing for drug efficacy? So what drugs don't work with me, because that ends up costing self-funded employers a lot of money if a drug doesn't work, and there's all the backlash from that. So we're looking at all these different things that we can bundle in, financial wellness, because again, millennials need a lot of help with that. So how can we help and put them into that one membership to make it, one agreement, one membership for the employee and the employer, and just a lot easier.
Yes, one-stop shop for
totally,
that. Okay.
Yeah.
So we'll wrap this up with the opening statement. I love the name Fresh Bennies. Tell me the story behind that. How did you come up with that name?
Okay. So we had picked about 90 names in the beginning, and I think we bought about 90 URLs also. So finally, it was our friend Tanya, who is now our chief strategy officer, but she worked at JCPenney with me, and she went off to Amazon for 5 years, and then we got to steal her for Fresh Bennies. So she came and she works at Fresh Bennies. And so the three of us, she's always been an advisor with us. So the three of us were sitting there, and Reid said, all right, we have spent way too much money on URLs. We need to pick a darn name and move forward. So we had a little come to Jesus. And so we love the word fresh. So we put the word fresh down the right hand, and we weren't sure about the other part of the name. So I was like, how do you say benefits in a cool way? We liked fresh benefits, but it was taken. And I was like, Bennies. I went to the Urban Dictionary. Sure enough, there it is. Got to get the Bennies. And so that's where it came from.
Oh, that's super. Well, this has been a real treat. Heidi Rasmussen, co-founder of Fresh Bennies today. Thank you for joining us.
Thank you very much, Bob. Appreciate it.
Thanks for listening to the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episode links, notes, and more. Be sure to subscribe to the Business of Healthcare podcast on Apple Podcasts or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jindal.utdallas.edu and then search under the Center and Institutes tab on the navigation menu. Also, we want to hear from you. If you'd like to provide feedback, make suggestions for future guests or show topics, or just want to get in touch with us, email us at healthcarebizpodcast@utdallas.edu. Biz is spelled B-I-Z. And let us know how we're doing. I'm your host, Dr. Bob Kaiser, with the Center for Healthcare Leadership and Management, where we're leading change by changing how we lead.